The Greater New Bedford Community Health Center monthly video series is brought to you by Senior Whole Health, a health plan for seniors that have both Medicare and Mass Health coverage. Online at seniorwholehealth.com.
Welcome to the Greater New Bedford Community Health Center. We will be presenting a series of seminars which we hope will inform the community and our staff about the benefits which are available to the people that we serve.
Good afternoon. It's my pleasure to introduce Dr. Leonard Morse, who will speak on if it's preventable, if it's predictable, it's preventable. Leonard?
Good afternoon, everybody. I'm Leonard Morse. I hail from Worcester, Massachusetts. That's the seal of the city of Worcester. And this is a conference for seniors, and I want you to know that I fulfill that requirement as an octogenarian, and it's a pleasure for me to be here. In my second post-retirement job, I practiced medicine in Worcester for many years, actually 50 years. I returned to Worcester in 1961 with my wife, and like every good son, we bought a house around the corner from where my parents lived, and my parents have since died. The house has been sold, and our 4 children have matured and live around the globe, and we're still in our house. So if anybody's interested in buying a lovely house in Worcester, 8 rooms, we've been in it 49 years, please call me. My second or third post-retirement job was coming to New Bedford to serve as the medical director of the Greater New Bedford Community Health Center. It was a terrific experience. I was here from 1996 to 2000 and really learned so much, and was inspired by the whole community health center purpose. And in 2000, I became the Commissioner of Public Health for the City of Worcester. That was my third or fourth post-retirement job, and I did that for 10 years, and I really enjoyed that immensely. And during the end of that period, Mr. Georgiopoulos, who was the Chief Executive Officer of the Greater New Bedford Community Health Center, asked if I would come and consult for him on a monthly basis, and I come here one day a month to serve that purpose, addressing issues of quality of health care, conflict resolution, and improvements that you can make as medicine changes. I realize that this is a conference for seniors, and when I was asked to give this talk, I selected the title, if it's predictable, it's preventable. If you think about it, it makes an awful lot of sense. If you can predict something that's going to happen, you can prevent it from happening, so that all accidents are preventable. So I'm working on that theme. In the first 2 years that I was Commissioner of Public Health for the City of Worcester, I conferred with my wife at breakfast time, and we decided that we will try and capture statements that would be helpful for people to understand how, if they understood the statement, it could help them prevent illness from happening. And the whole theme, I believe, even beginning in school, is to teach children in an age-related way what they can do to prevent illnesses and happenings that would detour them in life's travel in life's highway. And you think about it, and in Worcester we have 25,000 school students, and how important it would be to teach in a gradated way age-related things that they should know and understand as a continuum of their personal hygiene. Well, think about tobacco, think about alcohol, think about drugs, think about marijuana, think about sexual promiscuity, and think about speeding, think about helmets, think about seat belts, all the things that you have to do to preserve your health. So I applied for a grant, and it was granted, that we would make a statement every 2 weeks and run it daily for 2 weeks in the Worcester paper, a statement pertaining to health maintenance, health preservation, and we ran that. At the end of 1 year, I had 20. That's 2 weeks. It's 52 weeks. It's 26 statements. So this first slide depicts each one of the statements, because at the end of the year, I thought it actually was on December 1, which is World AIDS Day, and we put them together and we made a poster. And then the second year was another poster. And I thought in preparation for this talk that maybe I could run through these various statements. We could revisit them and see what you think about their purpose of educating people about how you can preserve a good health. The first in the upper left-hand corner was today is World AIDS Day, and we just had World AIDS Day. We encourage you to learn more about this global infectious disease. Consider those afflicted with compassion and understanding, and be reminded, AIDS is preventable. AIDS is a preventable disease. We have over 1 million people infected with the AIDS HIV in the United States. 25% of them do not know they're infected. So that means there are 250,000 people infected with the virus that do not know they're infected, and they serve as a reservoir for this infection. It's very important that anybody who has had behavior that they think may be high risk to acquiring the HIV virus should be tested. We can offer testing anonymously, and then if you are found positive, you can undergo treatment, will prolong your life, and will make you no longer communicable to an intimate partner. This is so simple, but so important. In the first one, that year was AIDS is preventable. That was what appeared in the newspaper for 2 weeks. It's a reminder, AIDS is preventable. Now on December 17th in 2003, if you drink, don't drive, keep your holidays happy. On January 5, the trouble with smoking is starting. If children go out behind the barn door and smoke a cigarette on a Friday night, do it again on a Saturday night, do it again on a Sunday night, by Monday they're addicted to tobacco. It's powerfully addictive. That's why in 1964, the Surgeon General of the United States, Luther Terry, issued the first report on the harmful effects of tobacco. At that time, 44% of the adults were addicted to tobacco. 2 generations later, right to now, still 22% of adults are addicted to tobacco. What it indicates is that young children begin the experience and become addicted When I went to college, we learned how to smoke. Now, kids go into college, arrive either a smoker, but they do not start smoking in college because they are very well reminded and educated about the harmful effects of tobacco. It's a remarkable observation. The next one, my wife said she didn't think this was very appropriate for elderly people. Actually, my co-pilot, we drove down from Worcester, and I asked her if she wanted to come, and she said no, because some of these she think were not applicable for seniors. But even seniors like to think young. Skiing, snowboarding, and snowmobiling are hard hat sports. They are. Think of the head injuries. This to me is very, very important. Children see over 12,000 violent acts per year on television. If you take young children, sit them at a play table, and put a toy gun down on the table, one of them will pick up the gun, and the first thing they do is they point it to another person and aim and shoot. Where do they learn that? They didn't learn it in our household. They learn it through television and through the violence that comes through in television. We have to be so attentive to that. This is a play on words. As I said at the beginning, injury prevention is no accident. And this is another one that we ran for 2 weeks. People make pollution. This is another one. Always rock, never shake a baby. The shaken baby syndrome. How pathetic that is. And this is very important. A prescription is an individual recipe. That's what the word RX stands for. In Latin is recipe. When you see the drugstore, RX is a recipe. Do not share drugs. That's so important. It's something, it's an individual recipe for you. The word virus, we ran this for 2 weeks. Everything's a virus, is derived from the Latin and means poison. I don't know how the term currently now, something going viral, people don't understand the origin of the word. It's never too late to stop smoking. That's so powerful, especially for seniors who still smoke. Within weeks, the microscopic appearance of the bronchial tubes indicate diminishing inflammation and healing from years of smoking. And as every week passes, there's healing of the lung. It's never too late to stop smoking. The issue about overweightedness gets a lot of attention, but it's simple. Body weight equals calories consumed minus calories expended. It's simple mathematics. The most assured way to lower the cost of health care is to stay healthy. So this is the whole theme of what we're talking. Not only is it important to stay healthy, your life is much more purposeful, meaningful, and comfortable, but we can all affect the economy. And we're championing and campaigning for preventive health services to be paid for by Medicare and all insurers, because that's what it's all about. Taking influenza vaccine is the most effective way to prevent influenza. Influenza is a seasonal viral infection that really afflicts seniors, and every senior should be immunized with influenza vaccine. Oh, this is one of my favorites. Do you understand what the movie ratings mean? Have you ever read the definition of the movie ratings by the Motion Picture Industry of America? Have you ever read what PG-13 means? Read about PG-13. When you get to the R-rated movies, I don't think adults should see them. I personally don't. I don't go to R-rated movies. This is the cigarette brand we recommend is Abstain. These ran for 2 weeks. That one began and it was in the middle of July. At the end of life, give life, be an organ donor. This is terribly important for seniors. nobody's too old not to be an organ donor. They have to, at the end of life, give life, be an organ donor. There are 80,000 people presently waiting for kidney transplant. There are 8 or 9 people dying a day waiting for kidney transplants. So you're never too old not to be an organ donor. I went to get my license renewed some time ago, years ago, and I told the clerk that I wanted to be an organ donor, and she looked up at me and she said, "You're too old." I realize I look old, but my cornea are fine. You know, skin is fine. I couldn't be a hair donor, but safeguard your children's teeth, give them fluoride. New Bedford, the city of New Bedford recently added fluoride to its water. Congratulations, New Bedford. Really terrific. Practice the ABCDs of HIV/AIDS prevention. Now, I want to remind you, all of these were created at the breakfast table, my wife and I. She was an English major, and I in medicine. A is for abstinence. B is to be faithful. C is to use condoms. D, don't use drugs. That's the ABCDs of HIV/AIDS. When I was in practice and had patients and would do an HIV test, and the test would come back negative, the reaction to people, patients, was so overwhelmingly emotional because people have this exaggerated thinking of what is marginal behavior, what is high-risk behavior. But just to know that your test is negative is so reassuring. And if it is positive, it is very, very reassuring to know that you can be treated long-term. This is a motto of the American Medical Association Alliance. That's the Women's Alliance division of the AMA, and I think it's a very, very important one. Hands are for helping, not hitting. Reduce the multitude of mosquitoes by eliminating stagnant water. This was in September of 2004. This to me is a very, very important message. And for seniors and all people, our world is too noisy. Tune it down, save your hearing. You see these cars go by and you get the thumping and this music, and so what are they listening to? The spitting images, chew or snuff is really bad stuff. I mean, people going from inhaling tobacco to chewing tobacco. Think before you get a tattoo. It's one decoration you cannot undo. What's the professional athletes, the basketball players? I mean, they're absolutely, the body art is phenomenal. And they are setting an example for our young children. Outfluenza is a motto, to cover your mouth and nose and wash your hands. And I think that personal hygiene has been very well educated in the schools. Children understand it. You see them cough into their elbow. This is one we just, you all can attest to this one, especially at Thanksgiving time. And we're so concerned about exogenous obesity and calories and eating and even going into some of these grocery stores, the abundance of food. I have a friend who said he's never met a calorie he didn't like. This is now the second year we carried this forward, and this is the same statement on World AIDS Day on 2004. And again, we ran, everybody liked this one so much, we ran it for 2 more weeks. Stuff the turkey, not yourself. This is another very important winter statement, a snowblower is hazardous machinery. 90% of the injuries happen to the dominant hand. Can you imagine that? And a lot of people, seniors, have snowblowers. So that 90% of the injuries happen to the dominant hand, and that means they're trying to unplug the snowblower, most likely. A New Year's resolution, count calories. They really do count. If you're over 65, under 2, pneumococcal vaccine may be for you. Ask your doctor. The pneumococcal vaccine is very, very effective in preventing pneumonia, especially in seniors. It should be, every senior should have had this vaccine. And this is don't use your hands to unclog a clogged snowblower. Lower the cost of health care by trying to stay healthy is a repeat. 1,200 people die from cigarette smoking daily in the United States. I don't understand how we, as a country, can permit the exportation of our tobacco product to other parts of the world. We do not allow the importation of addictive drugs, and yet we export the drugs. 70% of adult males in Moscow smoke, and the most popular brands are American cigarettes. I like this one. It's, again, coming back to HIV and AIDS. Spread awareness, not HIV/AIDS. We have to educate people about it. They have to understand how the virus exists in nature, how people become infected, and how they need to be tested so that the reservoir, the disease, the unrecognized people that are positive become recognized and are treated. March Madness, I'm a basketball fan. The ball is in your court. Stay active, keep healthy. I always thought I was a much better basketball player than I was. All young kids were that way. Be pedestrian smart. Always stroll, walk, jog, or run facing traffic. This is very, very important for senior people. At night, wear bright clothes, wear a reflector, eat less, exercise more. You will lose weight. A handout is not the best helping hand. Healthy minds, healthy youth. That's so powerful. That's really powerful. In our homes, as I said earlier, are porous to television. Kids learn. You just have to address the issues with your children. The misuse of any drug can destroy life. We, in Massachusetts, 2.7 people a day die from drug overdose. That's 1,000 people a year die from drug overdose. That's clearly preventable. All those deaths, to me, that is the plague of the 21st century. And now they're campaigning and championing the legalization of marijuana. The misuse of any drug could destroy life. Quitters do win if they stop smoking. The repetitious theme about tobacco. Play safe, never swim or explore without a buddy. I want you to know, my disclaimer is this is the first time I've given this talk as a collective thought process. It usually was one every 2 weeks. Be smart, don't mess with drugs. If it's predictable, it's preventable. You heard about that. Each day, 18 people die waiting for an organ, be a donor. It's incredible. It's totally incredible that we have such a waiting list. The number I gave earlier were just for kidneys. the cancer walk to cure. Half of all deaths are due to unhealthy behavior. Half of all deaths are due to unhealthy behavior. Think about it. You know, if you have good health, you have to do everything you can to preserve it. Just for the health of it, walk 25 miles a month. My wife does that, and she's pushing me, and I always have an excuse. But we're still together. And when we walk, we hold hands. Be wise, winterize, immunize against influenza and pneumonia. Help protect your community and yourself. Fetch influenza vaccine. So if everybody in New Bedford got immunized for influenza and you had an immune community, the virus would move on to Fall River. Well, not Worcester, because we have community immunity in Worcester, and that's what we strive for, working with the District Medical Society, the Department of Public Health, the Graduate School of Nurses at the University of Massachusetts, and the medical students. We immunized. It was a wonderful experience. I found my way into so many schools last year. I remember going to a school. You know, Worcester, like New Bedford, is a very diverse, culturally diverse community. There are 80 different languages spoken in the households in Worcester. So we went to a school, and when the grade students, the parents had to come to be there when the vaccine was administered. So this little boy, this 7-year-old boy, brought his parents. His parents couldn't speak English, and he was translating. The recipient of the vaccine, 7 years old, is translating what the doctor is saying, or the nurse, to the parents for their approval. Isn't that a beautiful happening? That the child understands it and understands the language, and they're recently settled in a new country and a new language, and we went ahead and immunized the students, trying to achieve 100% immunity. But protect your community and yourself. Fetch influenza vaccine. Only a fraction of the cost of health care is spent on prevention. We've talked about that. And this was the World AIDS Day 2005. And that is the poster. That's the poster. So I would like to now address certain things that are important for seniors in their home, for their home safety. I think this was a terrific exercise, even revisiting it now. I had these slides delivered Saturday, so I haven't really looked at them, but going through them now, it refreshes my memory of what a great experience it was. It was a grant. And then we wanted to continue doing it. But the grantor said that not enough people are reading newspapers. So they didn't want to fund it for a newspaper. They would do it for highway signs, bumper stickers, and other things like that. But speaking to a senior audience, most seniors still read newspapers, I being one of them. I begin the day reading the newspaper. It's if you want to be informed and you want to have unbiased information, you should read your newspaper every day. So last year I worked with the Senior Center in Worcester. I'm sure there's a Senior Center here in New Bedford. And they created, the Senior Center in Worcester created a brochure about safety in the home. And that's something that you probably have done here in New Bedford. It's very important. I think even a small publication to be given to every senior would be very worthwhile, because there are many hazards in the home. The most important hazard, the most critical hazard in the home is the floor. People falling. And when people fall, even in the hospitals, the most critical complication of hospitalization is falling out of bed and hitting the floor. So in the home, I think all sorts of supports in the bathroom, particularly in the shower, the rails, they should be, if they're not installed, they should be installed, because people simply could even have a seat in the shower where somebody could sit down. If they got lightheaded, they could sit down. Or they want to wash their lower extremities, they can reach their feet without losing their balance. I mean, these are very, very simple things. I think carpets, stairs, lighting, all of this should be addressed for seniors and those people living in public housing. It should be a priority for everybody. Growing old is a privilege. It's really a privilege, but it's also a challenge. And I think that aloneness is a very, very major problem for people living alone, and you should know your neighbor. We all should know our neighbor. Make sure they're safe. Make sure they have enough food. Make sure the heat's on. Make sure they haven't fallen. I have a next door neighbor who's alone, and I check in on him either by phone or personally twice a week. And it's important to do that. I'm sure all of you have such neighbors that you're aware of, away from their family. As people get older, they think that they are safe in their environment, and they may not be. I remember my mother lived 13 years after my father died in the house that we lived around the corner from. And I said, "Mother, we should do, my home is my palace." I can hear these quotes now. "My home is my palace. I don't want to move. I don't want to move." She stayed, and she became more reclusive. And the only person she would listen to was me, and then she would listen but wouldn't follow through with the suggestions. One night, I got a call at 1 o'clock in the morning that her house was broken into. She had called. I went down there, and some people broke through the kitchen door, broke the glass, and actually cut themselves, so they injured themselves. And my mother came down the hallway on her broomstick and frightened them out of there. You can't believe. And it was only after that she agreed to move when we sold her house, and she moved into a more protected environment. But as people grow older, their abilities change, and it's not at the same rate. So it has to be individualized. And I think probably the most important thing is trying to alleviate fright. I think people that live alone and get older become very frightened. And just listening to the nightly news is enough for even people who are not in any way limited to be frightened, because we live in a very violent society. And I touched on many of the aspects of why the society is violent. I mean, alcohol, drugs. everything won't happen to me, but it does happen to everybody. So you have to be cautious. I would like to end now and answer any questions you might have. I hope these biweekly ads that we put in the Worcester Telegram and Gazette you found interesting, and you might have a lot of questions about them. So I think I'll end now and open it up for questions.
What kind of feedback did you get from the community with the ads?
Oh, very positive feedback. Yeah, it was very positive. Yeah, I really enjoyed my job as Commissioner of Public Health, because the whole thrust is out there to prevent illnesses and happenings, and if it's predictable, it's preventable. So you have to be repetitious. You have to campaign. You have to advertise, and sometimes for young people, I found it very exciting to have the graduate nurses at the university come to the schools and talk to the students, because there's a different relationship between a younger person and a grandfather figure. But it was very well received, and we could have continued it. Yes, ma'am.
Is it permissible to use some of those? They're not copyrighted or anything like that?
No, they're not. Through the years, I've been very interested in coin language and statements like that, and I've been thinking about. This is just an example, but I've had a lot of them relative to medicine and how it's applicable to learning medicine, teaching medical students. You can use these statements that are easy to remember. And I've thought about putting down one or two down a day, and I started to compile them while my brain is still working, to be able to maybe do something with them. These are not copyrighted. You can use them anyway. If you land something like a big prize to go to Hollywood, just let me know.
I was going to do a small newsletter for this.
Yes, ma'am.
In our population, the state has made vaccines, not influenza particularly, but other vaccines, less accessible. And, for instance, hepatitis, pneumonia are now just reserved for very few people rather than, the general population. And I'm wondering if you think this is apt to continue, this cutting back.
Well, that's what the state provides. Right. The pharmaceutical industry is still manufacturing the vaccine. So if you want influenza vaccine, it's available. But the state is providing it, was providing free.
Our population, which is generally uninsured, we're having a bit of a harder time offering these things.
Now, if they're insured by Medicaid or Medicare, that should be covered. Look at the pharmaceutical.
The health safety net are not, and it's.
Well, we have to champion that they should.
We do. We do have to champion.
So that's an important question. So we need to align with you and Community Health Center, the Bristol South District Medical Society, the Massachusetts Medical Society, the Massachusetts Public Health Association. We need to get together and say, we need to have that vaccine, because it's a lighthearted comment, say, if everybody's immunized in New Bedford, the influenza virus is going to go to another community. And that's true. That's called community immunity. And not only. So if you get immunized, you protect the people in your family. You protect the people in your neighborhood. You protect the people in your municipality, and it just goes on and on. That's what immunology is all about, and there's no more effective way than the influenza vaccine, and it should be administered. There's a lot of confusion about immunization now, especially among parents and their concerns about autism, and but I think that everybody should receive the schedule of vaccines, and adults, people with chronic lung disease, people with immune deficiency syndrome, people over 65 should all receive the vaccine. People over 65 that we're talking to, the television audience, every person over 65 should have Zostavax. That vaccine is underutilized. It's the most effective way to protect shingles. Shingles can be a very, very incapacitating inflammation. Shingles is due to the Zoster virus. You're protected as having had chickenpox as a child, but then when you be older, that and the virus lives in the sheaths of the coverings of the nerves, and as your immunity begins to wane as you get older, it ignites, and then you get shingles. That's a protective vaccine. It's expensive vaccine, but everybody should get it, and we should, if they meet the economic needs, we have to find ways to get that vaccine for them. Zostavax. I mean, the pharmacies are all promoting influenza vaccine. So I think everybody, if there is a problem, I think you should let the health center know and see if we can join with you in helping make that available. But for the television audience, again, pneumonia vaccine, that's only once every 10 years. But if you haven't had it, you should have it if you're over 65. The influenza vaccine you should have every year. The Zostavax is just once. So, so it's very, very important. Are there any other ideas or thoughts or questions? The issue about driving for seniors is a very, very important one, and but that's up to a medical examination. You all remember Mr. Georgiopoulos, the CEO.
Thank you, Leonard.
You're welcome.
That's excellent, and I think I was thinking as you were talking about the copywriting and putting your newsletter, we'll probably put it on our website, put one every month. I think it's excellent.
Good.
Thank you for your fine presentation.
Thank you. Thank you.